McConalogue to introduce number 11. Deputy McConalogue.
And the question, Minister, is to ask you what steps you're taking to address the shortage of non-consultant hospital doctors at Letterkenny General Hospital in County Donegal. Thank you.
Thank you, Minister.
Well, thanks to the Deputy for his question. The number of non-consultant hospital doctors in the public health system has increased by over 200 in recent years and now exceeds 4,900. However, there are international shortages of NCHDs in certain categories and specialities, and there's also some hospitals, such as Letterkenny, to which it has been difficult to attract NCHDs for a range of reasons, including training opportunities and rural location. And we just have to live with that fact, but we have to do everything we can to address it. Letterkenny General Hospital had a non-consultant hospital doctor complement of 105 whole-time equivalents prior to the drive to support the implementation of the European Working Time Directive. To facilitate the implementation of the European Working Time Directive, it has received approval to employ a further 16 whole-time equivalents, increasing the total approved complement to 121 NCHDs. Since July 2013, there have been ongoing efforts to recruit doctors for the January 2014 intake of NCHDs to ensure the recruitment of all 121 whole-time equivalents. Unfortunately, due to national and international shortages of NCHDs, Letterkenny General Hospital, as of the 11th of February, has 26.5 vacant posts. However, 14 of these posts are covered at the moment by locum NCHDs via agency who are employed on a temporary basis to ensure continuation of service delivery at the hospital. Efforts are continuing to recruit additional NCHDs to the existing vacant posts. There are particular difficulties currently being experienced in Letterkenny General Hospital with regard to recruitment of NCHDs in general medicine, and this is replicated in many hospitals nationally. At present, there's 8.5 whole-time equivalents, that's 7.5 registrars and 1 SHO, vacant posts in the speciality of general medicine. NCHD recruitment and retention is required in order to support service delivery, to address reliance on agency and to facilitate the achievement of European Working Time Directive compliance. I set up the Brian McCrae Group to undertake a strategic review of medical training and career structure last summer.
Thank you, Minister. I have to interrupt you.
The group will make recommendations shortly on improving the retention of medical graduates.
The rest of the reply will appear in the official report, Deputy McConalogue.
Thank you, Minister, for your reply. You say at the outset, Minister, that there are international shortages and national shortages in NCHDs, and you also say that that's particularly acute at more regional hospitals around the country and more peripheral hospitals, such as Letterkenny. And your response to that then is that it's something we've got to live with. And you're not in your response really giving any specific ways or solutions as to how that might be addressed, which is actually what I was asking you in terms of how you might be able to address that. You've outlined that where there should be 121 NCH non-consultant hospital doctors in Letterkenny, there are currently 26.5 of those vacant, with 14 of those 26.5 actually filled by agency posts, no doubt at a much more significant cost than what full-time posts would be. To give you an example, Minister, of where this is having a real impact, for example, in the medical registrars doctor category at the moment, where the hospital normally would have had 10 in that category, there are currently 8.5.
Thank you.
And in order to comply with the Working Time Directive, that needs to go up to 15. And we've seen in recent times many days where there were significant backlogs in A&E and where there were people on trolleys and where there wasn't the capacity either at Sligo or indeed Altnagalvin to take that overflow, and the public had to live with that difficulty. And I don't think it's acceptable that the medium-term solution, just to I'll finish.
And I come back to you there.
I don't think it's acceptable the medium-term solution is to say that we have to continue to live with it. And I might ask you, can you elaborate on what steps you can take to actually address that so we don't continue to see it for the next few years?
Well, as the Deputy has acknowledged, we have approved more posts for Letterkenny. And the reality that we face is the difficulty in recruiting. But we continue to actively recruit. We continue to use agency locums to make sure that we do have a service and a safe service for the people of Letterkenny. And can I take this opportunity to congratulate the staff in Letterkenny, and I mean all the staff, and the wider group, and the support from Galway and Bill Maher and his team and the board, and the help that we had from Altnagalvin during the flooding. That unit is now fit to reopen, and we look forward to seeing the Deputy up there in relation to that. But I think that the hospital there is a critically important part of our health service. It will be supported, and I have no doubt that through the hospital group we will be able, through rotation, to attract more doctors, and that is one of the specific benefits of the hospital group, that people won't be going to specifically work in Letterkenny, but they'll be rather joining the North-West group of hospitals and rotate through the various hospitals during the course of their training. And indeed, it will also make available to Letterkenny and the people of Donegal greater level of expertise from the group itself than hitherto would have been the case.
Deputy McConnell.
Thank you, Elaskin Corla. I concur with you, Minister, and thank you for your comments in relation to the staff. I think what they have achieved, the staff working with the management of the hospital, has been heroic and amazing over the last period of time. The flooding that happened was one of the biggest disasters at any of our hospitals in the history of the state, indeed. And Letterkenny Hospital A&E, for example, being the 7th busiest accident emergency in terms of admissions in the country, shows you the amount of traffic and patients that come in and the demand that's on that service. And I think looking at the figures here today in terms of how the difficulties they've experienced in terms of recruiting the staff they need and the staff that they've been awarded, shows even more so the job of work and the Trojan work that the hospital has done to try and match the demand that's made of it or that's required of it on a daily basis. But I do think we need to see solutions, because you've outlined that that the number of NCHDs at the hospital has been increased to 126, but the real difficulty here is in the recruitment.
Thank you, Deputy.
I know you've indicated that through the new hospital group there may be potential for rotation there, but I think whatever the solution is, whether it's that or international recruitment in the medium term until we can generate more supply nationally, we need to see solutions come to bear very quickly.
Thank you, Deputy.
Because we can't continue just living with it the way it is, because we will, if that's the case, we will continue to see more delays in A&E and unacceptable situations for patients in the county.
Well, actually, yes. I mean, look, the Deputy will be aware too, I'm sure, from earlier responses that, you know, the model of care needs to change in this country in both the hospitals and in general practice. We need to move away from this episodic illness that we currently approach, the service takes, to more prevention and more chronic illness management in primary care, and Minister White is very much over this and is in consultation with the GP organisations, and I thank him for that. But equally in the hospitals, we have work being done by NCHDs that could just as well be done by other healthcare professionals, and we alluded earlier to the skill mix, where, you know, we have nurses performing duties that healthcare assistants could do, we have doctors doing work that advanced nurse practitioners could do, and we've both of them doing work that would be better done by physiotherapists or speech and language therapists or other allied healthcare professionals. So we have to address this by innovation and new ways of using the resources available to us, which I believe not alone will be more cost effective and better outcomes for patients, but would also be more rewarding for the professionals involved.
Thank you, Minister. We now go on to number 12.